Good morning. I'd like to welcome everyone to our virtual session entitled Working Together for Positive Mental Health, hosted by Ottawa Public Health and the Ottawa branch of the Canadian Mental Health Association. My name is Chanel Brown, and I am a public health nurse from the mental health team at Ottawa Public Health, and I will be your MC this morning. Bonjour, je vous souhaite la bienvenue à notre séance virtuelle intitulée Travaillons ensemble pour une santé mentale positive, organisée par Santé publique Ottawa et la filiale d'Ottawa de l'Association canadienne pour la santé mentale. Je m'appelle Chanel Brown et je suis une infirmière en santé publique qui fait partie de l'équipe de la santé mentale de Santé publique Ottawa. Je serai votre maîtresse de cérémonie ce matin. I would like to begin by honoring the people of the Algonquin Anishinaabe Nation who have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land. I would like to honor the peoples and the land of the Algonquin Anishinaabe Nation, as well as all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. We are pleased to have you join us during Mental Health Week. The theme this year is empathy. Having empathy means that you understand others' emotions, share their feelings, and respond with compassion and care. It is being able to put ourselves in others' shoes. Empathy strengthens our relationships at home, in the workplace, and in our broader community, and helps us connect with people. Nous sommes heureux que vous vous joigniez à nous pendant la Semaine de la santé mentale. Le thème de cette année est l'empathie. Avoir de l'empathie signifie comprendre les émotions des autres, partager leurs sentiments et réagir avec compassion et avec soin. C'est être capable de se mettre à la place des autres. L'empathie renforce nos relations à la maison, dans le milieu de travail et dans notre communauté. Elle nous aide à établir des liens avec les gens. We have some wonderful speakers this morning who will share tips and strategies to build resilience and practice empathy. Our speakers include Dr. Vera Etchis, Medical Officer of Health with Ottawa Public Health, Dr. Tim Simboli, Executive Director of the Canadian Mental Health Association, Ottawa Branch, and Nuruddin Mohamud, Public Health Project Officer with Ottawa Public Health. After 2 years, the pandemic has weighed us down in many ways. It's been stressful, isolating, and emotionally exhausting at times. At Ottawa Public Health, a population health report that was completed in the fall of 2020 showed that 40% of people reported their mental health as fair or poor. And this is compared to 9% who were reporting the same prior to the pandemic. Residents were concerned about burning out because they had not had a break in their responsibilities. They were worried about losing supports, a weaker sense of community belonging, and an increased sense of loneliness. 25% of Ottawa residents said there was a time in the past 2 weeks when they wanted to talk to someone about something on their mind, and this includes emotional and mental health, but they did not know where to turn. And this number increased to 40% for racialized communities. Practicing empathy is one way to support each other through these trying times and to come out more resilient on the other side. Without further ado, I would like to welcome our first speaker, Dr. Vera Etchis. Sans plus tarder, j'aimerais souhaiter la bienvenue à notre première conférencière, la Dr. Vera Etchis. Dr. Etchis is the Medical Officer of Health at Ottawa Public Health and has been a very prominent figure and played such an important role in our community during this pandemic. So we welcome Dr. Etchis. Dr. Etchis, we have all been through a lot in the last 2 years. So my first question for you is, how have Ottawa residents demonstrated resilience during this pandemic? And what are some ways that we could all continue to build resilience?
Thank you, Chanel. Bonjour tout le monde. It is incredible. When you think about how Ottawans have come through the length of this challenge that the pandemic's given us, as well as the uncertainty I think those are the two things that have really pushed people's limits when it comes to resilience. And yet what we saw is that people were finding ways to, from the very early days, support each other by listening to each other, reaching out in virtual ways, checking in, bringing practical support, and establishing new routines. So people weren't able to do things they usually would, with the distancing requirements, the other kinds of things that came into play, the public health restrictions on activities. But we saw people were practicing resilience when they found new ways to be active instead of going to the gym, picking up something else in their neighborhood, finding online options, things that would still help people pay attention to how they were doing and their own physical health. We know that's very connected to our mental health as well. Practical things like sleep. Certainly, I think there's a list of practical tips that help build resiliency in any situation, and we saw people using some of these tips. I'm happy to speak about those if you like. I just think the word you're emphasizing today, the empathy, was really shown when people listened to each other, when they recognized we're not all experiencing the same thing. Some people had more difficulty through the pandemic and more challenge due to their occupation. People understood the challenge for frontline healthcare workers, for instance, and found ways to support and encourage them. I think these things, some of them were done at an individual level, but some of them you could see the community coming together and also fostering resilience, so helping people get through.
Great, thank you. Yeah, it has been very encouraging to see all the ways that people have been building resilience and working together and showing each other some empathy. That's been really good, even though we've experienced some challenging times, and there have been some ups and downs for sure, but it's nice to see everyone coming together. So you did mention that there were a couple of strategies that people could use to continue building resiliency as we move through this, and we've highlighted a couple of them on the slide here. So it's really focusing on things that have helped you cope with stress in the past. What are some of those strategies that you could keep using now? Some positive coping strategies that help you stay well. You can change the way you respond to stressful events. We can't always control what happens to us, but we could change the way that we react to these events. Making sure that you're paying attention to your own needs and reaching out for support if you do need it, staying connected with those people that you trust. And positive self-talk can also make a really big difference. I know sometimes this can be a challenge the longer we go through some of these events, but the way you look at things and the outlook that you have really does have a difference as well. And then a couple of other things we have listed on the slide here, finding solutions. So focusing on things that you have control over. Being okay with imperfection. You talked about how we've had a change in routine. And different aspects of our lives have been affected. So really, we might not be able to do things the way we used to before, and that's okay. And self-care is such an important piece of that as well, really taking care of yourself. And we'll speak to that a little bit more later as well. And then I already alluded to asking for help if you need it. We'll speak to some resources later in the session as well. And the other thing I wanted to bring people's attention to is our Have That Talk video series. We have several videos available on our website, havethattalk.ca, and there's one in particular on building resilience. So if you have time to take a look at that, that would be great. Check it out, havethattalk.ca. All right, so you did touch a little bit on empathy in the previous question, but let's talk a little bit more about it now. As things have constantly been evolving throughout the pandemic, as we've learned more about the COVID-19 virus, different protective measures have changed accordingly. What are some ways that we can demonstrate empathy now that certain measures have been lifted and residents are really assessing their own level of risk before participating in activities?
So I think what I would like to highlight to begin with is that importance of social connection as one of the ways that we continue to be able to cope with hard situations and get through them. So, resilience is the definition of resilience is really being able to work through life's challenges in a positive way and to recover afterwards. And so part of what we need right now to be resilient is social connection, because we lost that in many ways. And so having to approach social connection with empathy is the case right now, because people are still in an environment where COVID is high and where some are going to be at greater risk for severe outcomes compared to others. Others right now are feeling perfectly fine to connect because they've had COVID or they've had 3 doses of vaccine and they're younger and they're not at risk for severe illness. And so it's really being able to shift our approach based on the needs of the people that we're connecting with. And I think that compassion to understand that there are difficult situations people are still facing with concerns about severe illness. And so respecting the use of masks, that's an additional protection for some, being able to connect outdoors, offering these choices, I think is a useful way to approach this. So as you're looking at meeting up with others, to be able to offer choices about how to approach those connections. So I say that the social connections are key right now, because some of the tips you mentioned on the last slide, Chanel, they really are about being able to talk with others about how you're doing. And that's much easier to do often in person. It doesn't have to be in person. For some, the virtual choice is still the best choice. But not to ignore how you're feeling, and to be able to express that and talk to someone that you trust about what you need at this time is still really important. The other things we talked about there in terms of being able to seek out care if you're needing care, if things are too difficult, you're not able to get back to the routines that you used to be able to maintain. We're not expecting people to be able to do things perfectly and be perfect parents or anything like that. That's the point you made about where we have to be realistic. But if things are too much of a struggle and you need help, again, there are virtual options for people. So I'm sure you'll talk about that. And so, basing your approach to seek in-person or virtual options based on your level of risk for COVID, I think is reasonable at this time. I think the idea of connecting with others can be part of what we need to find solutions. Sometimes it's hard for us on our own to switch to a more positive way of viewing the things, find the hopeful way forward, find what is working, think about what I can do. It's pretty easy to say, focus on positive talk, but it can be very hard to do, especially on your own. So again, that reaching out to others, it doesn't have to be a counselor, actually, but just somebody else to add in some other perspectives. And so the empathetic way to do that, again, is to ask questions and listen and think about, how is that for you? What are you experiencing? You can say, I'm experiencing this is what's happening to me. And if you're listening to someone, to be able to hear that and then reflect back and say, well, have you thought about this? And just help again introduce some ways to go forward to find some practical solutions about what is in people's control. That can make a difference. So I think this again can make a huge difference. Also bringing people back with empathy to the things they can do to look after themselves. So asking about how people's sleep is going. Sleep is extremely important for our well-being, to stay on track. Also again, the physical activity, are there things they're finding that they are able to build into their day, even if it's on the way to the bus or, picking kids up from school, these kinds of things. Doesn't have to be a big race, but just making sure that each day people are getting out and being a bit active is another way. So an empathetic approach is to explore how things are going for people with open-ended questions.
Great, thank you so much. So yeah, it's that kindness, it's that respect, it's maintaining those connections, and we can all keep supporting each other this way. Thank you, Dr. Etchis, that's great. Our next speaker is Dr. Tim Simboli. Notre prochain conférencier est le Dr. Tim Simboli. Tim holds a doctorate in psychology from Carleton University and has spent more than 40 years working in the mental health and social services sector in Ottawa. He's held the role of executive director at CMHA Ottawa since 2011. And prior to that, Tim spent 17 years as the executive director of Family Services Ottawa. He worked as the director of operations for the Boys and Girls Club Ottawa for 5 years, and also 10 years as the senior clinical supervisor at the Youth Services Bureau of Ottawa. So welcome, Tim. We're very happy to have you join us today. And I'd like you to just share a little bit about what CMHA Ottawa, and the work that you do.
Sure, happy to. This organization has been around for nearly 70 years, and we've been involved with the promotion of mental health and doing things to improve people's mental health. Right now, the bulk of our work, probably for the last 2 or 3 decades, has been focusing on people who have serious mental illnesses, people who have often untreated, homeless folks, folks with addictions, really some of the hardest to serve people in our community. And we provide our services in a very kind of holistic way. We look at all the things that go into supporting your optimal mental health. We do it in the community where people live. We help people get housing and good medical care, good vocational activities. I guess what we have learned through all of that is the things that are needed to make sure that you maintain your mental health and maintain your life in good mental health to the extent possible. So that's where Mental Health Week comes along, because it's an opportunity to maybe let folks know what they can do to ensure that the problems don't become too big, too large, too overwhelming.
Great, thank you. All right, so this question is a bit similar to the one I asked Dr. Etchis, but I'd love to hear your thoughts on this as well. So, at this stage of the pandemic, where people have a difference of opinion, what are some ways that we can be more empathetic?
Yeah, I think part of this is to recognize kind of where we are in this. You mentioned that I've worked for ages in this sector, and I've never seen anything like the last couple of years. It really is a once in 100 years kind of situation. So it's not surprising that it's taxing us as much as it is, and it's not surprising that the issues and the anger and the frustrations are building and building and building. We're into wave 6 of the pandemic, and gosh, it's just hard to believe that we're still struggling and we haven't given up. I think that's one of the positive aspects of this is that we are running sessions like this, and we are trying to be more resilient, as Dr. Etchis said. That's really important. I think part of what's happened as we've moved apart and we've lost some connection over the years, we've actually lost that physical contact, that social contact, where we can have normal interchanges with people. Everything goes on Zoom if we're talking to people, or it's on the internet, Twitter, Facebook. lots and lots of social media, and it really has taxed us in terms of being able to kind of connect as human beings. And I think that so it's not surprising that we're finding a lot of animosity, we're finding a lot of polarization. We've experienced it this weekend where there has been really conflictual things going on. And one of the themes in all that, whether you agree with somebody or not, what I've heard a lot of is that people don't understand me. People don't feel heard. And empathy is the antidote to that. Empathy is the way by which we do hear other people. Not necessarily that we agree with them, but we understand what they're going through. And I think something that was said earlier by Dr. Etchis about the impact of the pandemic, it has been different on different people, but it's also been felt differently even when the impact has been the same. So there's a very kind of personal experience that's going on in what is a global kind of phenomena. And people just they feel isolated and alone, and they can feel, as I said, unheard. And empathy is where we can start to break that down. It starts from being well-grounded yourself and taking care of yourself. Again, a good night's sleep, exercise, and a good meal are probably the simplest and easiest things that we can do that keep us grounded. And then understanding, then we can turn to other people, the people around us, the ones we are in contact with, whether it's in person or it is through Zoom. And a lot of long distance relationships have certainly happened through Zoom. Could be with family, could be with our coworkers or the public, as in this particular session. But it's to make the effort to find out what the other person is experiencing, and to put yourselves in their shoes, to understand the context of what they're dealing with. And I think this is going to be really important as we start to work our way out of this pandemic, because people are going to relax their expectations in very different ways. There's going to be, Ottawa Public Health provides really great ways of relaxing, and we follow their lead very carefully. But individuals kind of move at different rates and different speeds, and you have to really kind of think about what the experience of the other person is and put yourselves in their shoes. So, do they have extraordinary health issues that they have to deal with? What are their social circumstances? And that's if the situation is different, but oftentimes it's not different. It's exactly what you feel. People in the same household can be experiencing this in very different ways. And so to understand and to speak up and say that, to say something about it, to make sure that the other person knows, it breaks down that loneliness, it shares the load, it makes us more capable of getting through this as individuals, and it provides support for the people around us.
Great, thank you. Yeah, it's so, what you said, really tuning into what others are saying and trying to put yourself in their shoes. We used to sometimes say, we're all in the same storm, but we're in different boats. So you don't really know what
Exactly.
others have weathered to get here, nor do they necessarily know what you have weathered. So yeah, it's being attentive to that as well. So thank you. That's wonderful. That leads into the next question nicely, because you talked about needing to be self-aware as well, and we spoke with Dr. Etchis as well about some self-care and needing to take care of yourself. So I'd like to hear from you as well. If someone is feeling stressed, anxious, or worried, during this current stage of the pandemic, what are some things that we can do to take care of our own mental health?
Yeah, I kind of think of it as sort of multiple rings. The core of our resilience and our ability to get through this is to take care of ourselves. And there's, we've talked about most of them: keeping in good physical health, keeping your mind active and busy, looking to do little things that kind of, get you interested. Small little hobbies. I've been saying we don't need to learn, everybody doesn't need to learn how to do sourdough bread, but maybe they need to try something a little bit different. They don't need to start something grand, just something little. So you start with yourself as the core of it. And then I think you look at your kind of immediate surroundings, and that's, the people around you, the people you're in regular contact with, your friends, your family, and you can look to them to help prop you up, just as you would prop them up. So that's kind of the next ring, and you make sure that you be a little discriminating, I guess, when it comes to who you listen to and who you talk with. And it's people, you'll be able to tell the people that bring you up, and they're the people that you kind of want to gravitate towards, and get into almost like an exchange of support with them. And then I think, if that's not sufficient, then I think you got to go outside your normal circle, and that's where you start to look at other places, health and resource centers or helplines, or your family physician, places where you can get that little bit of extra help, and it may be a little bit more. And there you flashed up the screen about ways that you can manage your stress as well. And so we talk about making sure, don't get hooked on TV or social media. Try to keep things in perspective. But those are the sorts of things that you can do to kind of keep yourself strong, and then look to the outside world and to the professional world maybe when that's not good enough.
Great, thank you so much for that, for sharing these messages and strategies with us. Now, I'm very happy to introduce my colleague, Nuruddin Mohamed. Je suis maintenant très heureuse de vous présenter mon collègue, Nuruddin Mohamed. Nuruddin is a public health project officer with the Mental Health and Substance Health Unit at Ottawa Public Health. And so a month ago, OPH and partners launched an initiative to provide residents with information, tips, and connect them to services. So I'm very happy to hand it over to Nuruddin to tell us more about this new project.
Thank you, Chanel. I've been thinking about the concept of empathy, and I was reminded of a quote by Roman Krasnatic. Empathy is the art of stepping imaginatively into the shoes of another person, understanding their feelings and perspectives, and using that understanding to guide your actions. Empathy can come in many forms. It's not always about taking action. It may just be about lending an ear and listening to someone who through something. It may be about talking into a consideration. It might be taking into consideration someone's circumstances, so you can really understand their perspectives. It's about being compassionate and non-judgmental and understanding. I would like to take a few minutes to demonstrate how an organization how as an organization we have been able to see the perspectives of others by working closely with the community, and by using evidence and data to create programs and services which promote resilience and which provide our community with safe space where our culture, diverse and non-judgmental staff can provide support alongside our mental health and addiction partners. It's no secret that the pandemic has intensified many issues in our community, and the mental health and substance use health needs of our residents are one of the many issues. Through the collections of COVID-19 disaggregated data, and through OPH population health survey on the mental health needs of our community during the pandemic, we know that certain communities have been disproportionately affected, and are reporting worsening mental health compared to others, and those include parents, those under 45 years of age, people with disability, people not born in Canada or racialized communities. Chanel spoke about the percentage of Ottawa residents who needed to speak to someone about their mental health, but did not know where to turn to, and that this percentage is higher for racialized communities. Pre-COVID-19 also demonstrated that people living in least advantaged neighborhoods have more than twice the rate of emergency departments visits from mental health and addictions. So these neighborhoods were chosen by working with the community to hear their perspectives, using the data available to us, and working with parents, working with partners, and to implement this pilot where we can ensure we have trained non-judgmental public health professionals who understand the needs of the community. They understand the community because we are from the community. We are able to communicate our understanding of the community's needs by regularly adapting our services and making changes to maximum impact. We're not saying we have all the answers, of course not, but we hear you, and we want to work alongside you. Alongside you as we rebuild our community together. As Vera has said in the past, services alone are not the only indicators of good health. Where we live, work, and play significantly impacts our health. Collaboration with Access MHA, One Call, One Click, Upstream Ottawa, Counseling Connect, and our Community and Social Service Department allows us to come together and provide a wrap-up service to those most impacted by the pandemic. The goal is to increase help seeking and access to culturally appropriate support, build capacity of service providers reaching racialized communities, and increase access to short-term and long-term counseling. Shortly, you will see a video walkthrough of the Wellness Hub and the services that are provided. As we mentioned before, our data shows that many in our community do not know where mental health and substance use health supports are. Encouraging help seeking and connecting residents to services in our primary goals. I will give you an overview of these services for anyone listening today who need to speak to someone. Help is available. I'll start with the crisis supports. The COVID-19 pandemic is a very stressful event for Ottawa residents and communities in Ottawa. Ottawa residents are reporting worsened mental health and emotional well-being, loneliness, and weaker community connectedness is the one. 3 in 10 Ottawa residents want to talk to someone about their emotional state or mental health, but do not know who to talk to. There are many resources available in our community. We will touch on few of the main ones. You do not need to counsel anyone. If you come across someone in crisis or who needs someone to talk to about their mental health, please call one of these phone lines. And know that if you are unsure of what to do in a given situation, you can call for yourself. For example, you can call the distress center and explain the situation to them and ask for advice. They are here to help. The resources listed on this slide are all available 24 hours, 7 days a week. Hope for Wellness is one of the ones that are available. It helps all Indigenous people across Canada. Phone or chat is 24/7 for counseling and crisis intervention, and is for hopeforwellness.ca. That's the website that you could reach to. Resources for crisis support. These are the crisis services that are all available for children, youth, and young adults. Again, these are available 24 hours, 7 days a week. YSP, the 24/7 crisis line, and chat services are for children and youth age 17 and under who are experiencing a crisis, and for parents, guardians, caregivers, friends, or service providers who are concerned about a young person in crisis. The 24/7 crisis line is 613-260-2360 or 1-877-377-7775 for Eastern Ontario. Parents, guardians, caregivers, friends, and service providers who are concerned about young person in crisis, you could go to the Kids Help Phone, which is 24/7 national service for anyone under 18 and their families or caregivers. There's also Good to Talk, Ontario-based resource that provides support to post-secondary students. Good to Talk is a free confidential service for post-secondary students in Ontario. It's available 24/7, 365 days a week, a year, by calling 1-866-925-5454. Post-secondary students in Ontario can receive professional counseling and information and referrals for mental health and addiction for well-being. Access MHA and One Call, One Click are all new resources for help that help people connect to the appropriate mental health and substance use resources. Here's how it works. You visit their website to complete a form. That's one. Once the form is completed, a mental health and addiction professional will reach out to you to discuss further. They will connect you to the most appropriate resource. Access MHA is for those 16 years and older, and One Call, One Click is for children from birth to age 21 and their families. The walk-in counseling collect offers free counseling sessions offered through one central number, phone or video at this time, but it's phone or video at this time. But depending on the next steps with the lockdown, we anticipate that they will return to in person when it is safe to do so. Counselingconnect.org, that is the website that you can go through. There are now 18 partner agencies since the addition of ACB services. They accommodate over 600 appointments a month. In January 2021, they hit a record high of 687 appointments. This was partially due to one-time funding received to have more support to the platform, but also demonstrated a need. Booking an appointment would only take the client a couple of minutes. They will choose the type of service they are looking for through the platform, then the date and time that works for them, and then receive an email with the detail on their counseling session. Bounce Back is a free skill building program managed by the Canadian Mental Health Association, CMHA. It is designed to help adults and youth 15 plus manage low mood, mild to moderate depression and anxiety, stress or worry. It's delivered over the phone with a coach and through online videos. You will get access to tools that will support you on your path to mental wellness. Please visit the bouncebackontario.ca for a referral form and more information. One of the many findings from Mental Health Ottawa's Black Community Research Study was the lack of awareness of ACB focused mental health support. The study reveals that 58% of ACB research participants cited lack of shared identity as a barrier to accessing mental health supports. Fall of 2020, OPH worked with Somerset West Community Health Center to develop this list. We work with partners from the Ottawa Black Mental Health Coalition. Following a series of consultation with organizations with a mandate to provide service to ACB communities, this list was developed, and it was launched on Bell Let's Talk Day on January 26, 2022. This, and along with a detailed list of services and programs, can be found on our website. This is a visual of the 5 pages within our website where you can find the resources just mentioned, as well as fact sheets and tips and strategies to protect and promote the mental health of our community. Thank you.
Thanks, Nuruddin. And now we're going to take a couple minutes to watch a short video about the neighborhood wellness hubs that Nuruddin was speaking to. So you get an idea of what they look like and what kinds of services you'll be able to access there.
Hi, welcome to Ottawa Public Health's Neighborhood Wellness Hubs. My name is Kim, and today I'm going to take you on a tour of one of the many wellness hubs we have located across Ottawa, offering you a safe space to drop in and talk to one of our caring staff. Follow me to know what to expect and to meet some of our partners.
These wellness hubs were created with the support from many partners, which means you will have access to additional services. What's more, you don't need a health card or to make an appointment to come in and chat with us. We are here to give you easy access to important services. Did you know 1/4 of Ottawa residents who wanted mental health supports did not know where to find help? Of these residents, 40% identified as visible minority or racialized. To reduce the barriers to accessing mental health services, Ottawa Public Health has located these wellness hubs in neighborhoods where health inequities exist.
So when you come in, you will see an Ottawa Public Health booth set up with many mental health and substance use health resources. Here, you will be greeted by culturally diverse public health staff who can provide strategies, tips, and resources on wellness, support you with booking short-term counseling through Counseling Connect, and can assist with referring you through Access MHA and One Call, One Click. Now, let's go meet Marie-Claire, one of our partners from Community and Social Services. Hi, Marie-Claire. Can you talk to us about the services you're offering through these hubs?
Hi, Kim. Yes, of course. This is the Employment and Social Services table. We represent all kind of programs like Ontario Works, Ontario Disability Program, and EHSS. So depending on the needs of the person or the family, we go through those programs for funding or coverage. We help people in the community with financial assistance, with housing help, or any to secure housing, or any employment support. We have here some posters to help you with our services. So Ontario Works program, we have all kinds of services. We have for basic needs, health benefits, employment, learning program, life stabilization, or emergency assistance. So that can help your team navigate a little bit more with our programs here. And just for myself, I'm an outreach caseworker, so we are new in the community and with the hubs. We have different locations, and this is our new team and our new goals.
Thanks so much, Marie-Claire. These are some great services that you're offering to the community. Now let's go chat with our friends from Upstream Ottawa. Good afternoon, Ed.
Yeah, good afternoon, Kim.
Thank you for being here.
Thank you.
Can you tell us a little bit about what clients can expect from Upstream Ottawa when they come to one of our locations?
Thank you very much, Kim. Through Upstream Ottawa's SAPASI program, African, Caribbean, Black youth can expect to receive a completely new approach to meeting their mental health and their addiction needs. And together with our Black clinicians, the youth will receive a culturally affirming mental health and addiction support that is grounded on Afrocentrism. And as an organization, we are here to build a supportive community around the individuals and their family that is safe, effective, and comprehensive, which encourages the youth and empowers them to recover. And as a result, it helps them to reach their full potential.
Thank you so much, Eb. This is great. This is really going to benefit a lot of our clients. This is our quiet and safe space for private conversations. Here, you can chat with one of our staff knowing that everything you say is 100% confidential. Everyone has a story, and we're here to listen.
For more information and to find out which hub is nearest to you, please visit ottawapublichealth.ca/neighborhood wellness hubs.
All right, so this concludes our event for today. I would like to thank the presenters for sharing some practical tips and information with us, and thank you to everyone who has joined us online today. Ceci conclut notre événement. Je tiens à remercier les présentateurs d'avoir partagé avec nous des conseils pratiques et de l'information, et je remercie tous ceux qui se sont joints à nous en ligne aujourd'hui. One final reminder that there are resources available if you need support. Visit ottawapublichealth.ca/COVID mental health for more information and a complete list of the resources that are available. Un dernier rappel, il y a des ressources offertes si vous avez besoin de soutien. Consultez le site santépubliqueottawa.ca/COVID santé mentale pour obtenir de plus amples renseignements et une liste complète des ressources. Thank you again, everyone, for participating and have a great day. Merci encore et bonne journée.